Hi guys! Welcome to our G classroom. So for today, we are going to talk about the HIV and the AIDS. So we will differentiate the two as we go on with our discussion. But before we proceed, let's know if what is the meaning of the red ribbon here. So the red ribbon is an awareness ribbon. It is used as a symbol for the solidarity of people living with HIV and AIDS. The heart shape here is a manifestation that we should not discriminate the people living with HIV and we should not judge them. So let's continue. So good day. So the clock is ticking. According to the United Nations, the Philippines is one of the only a handful of countries at risk of full-blown AIDS epidemic. So before we move on, we need to define what is HIV. So HIV stands for human immunovirus. So human meaning to say it can be passed on from one person to another. So the virus can be transmitted from you towards me or from me towards you if we have a contact. So later we will know if what are those contacts or the mode of transmission from one human or from one person to another. Immunodeficiency, it means that it weakens the immune system. So the virus could really weaken our immune system as we acquire them from the different modes of transmission. So the virus is a virus that attacks the immune system. So that is what we call human immunovirus. So the second one is actually the AIDS. So AIDS is actually acquired immunodeficiency syndrome. So it is a condition resulting from severe impairment of immune system's ability to respond to invading pathogen, which is the HIV. Ultimately, it affects the body system. So once it is inside our body, or once the HIV is inside our body, it can be a full-blown AIDS as a result of being infected with human immunodeficiency virus. So basically, the AIDS could develop, or the syndrome or the signs and symptoms or group of signs and symptoms can be present once a person is infected with HIV. So about 1 to 15 years, it can become an AIDS once we are infected with HIV. So when we say incubation period, it is the time where the virus could be detected or could be seen in a test or a HIV testing. So when we say variable, the detectable antibodies is 1 to 3 months or 3 to 6 months or up. Meaning to say, once we have a sexual contact today, about 3 to 6 months, it can be detected through the HIV testing. So meaning to say, up to 6 months, we need to wait 3 to 6 months before we have our HIV testing. So by that time, we need to have an abstinence or no sexual contact at all. HIV infection to AIDS diagnosis is less than 1 to 15 years or longer. So it would take 1 to 15 years. So the mode of transmission of HIV and AIDS, we have a mnemonic here, which is the BUM or the boom boom boom. So the first one is the blood transmission. The second one is unprotected sexual contact. And M is mother to child transmission. So the blood transmission, first under this is the needle stick injury. So for example, if a drug addict is using a needle and then that needle is being used by another individual and vice versa, they can contaminate themselves with the use of the contaminated needle. So if the HIV patient use a particular needle and then utilized by the other, so they can infect the other person or the next person who will be using the needle. And then exposure to an infected client's blood via open wounds. So it's the same concept here in the needle stick. So for example, if I have an open wound and the blood, for example, of a person with HIV splash within the wound, so definitely that contaminated blood of an infected person could actually penetrate on my wound, and later on there is a chance that I could acquire the HIV from that person. Or mucous membranes. So mucous membranes, just like uh, an opening in our mouth, in the vagina, in the anus, or in the penis, in those mucous membranes. So meaning to say that the virus can be transmitted with this means, and also via blood transfusion. So long before, the blood transfusion is one of the risk factors, but right now the blood transfusion is safe because they are performing blood tests of different communicable disease or sexually transmitted infection that are detectable in the test. So before the blood transfusion will commence, it should be tested. And HIV testing is one of them, so that the recipient of the blood is also safe. Another is the unprotected sexual contact. So, unsafe sexual practices. So, those sexual practices, the vaginal sex, the oral sex, and the anal sex can actually become a mode of transmission if we are not using a condom or any barrier to protect ourselves or our partner. Another is the risk for infection is greater for the partner who receives the semen. So for example, in the oral sex, if the one who performed the oral sex is the receiver of the semen, then there's a chance, especially if the mucous membranes or the mouth ulcers are present. So by that wound, then the HIV could penetrate. Another is the vaginal sex. For instance, if the vagina of the female is having a wound or open wound, then the semen of the male could penetrate into the wound, and that means that it could also infect the female if the male is infected with HIV, or vice versa. So if the male has a wound on his penis and the girl or the female has an HIV, then she could transmit the HIV to the male, and even into the anal sex. So once a person or a male performed an anal sex to a different person, or to from a male to a female also, then that can be a means of transmission. any sexual activity that involves direct contact with vaginal secretions and semen. So that's it. The last one is the mother-to-child transmission. So the HIV can be transmitted during the pregnancy. So since the mother, for example, she's uninfected with HIV, then it could also infect the child. But right now, it is also possible that the baby could not be an HIV positive if the mother takes an antiretroviral drug. So meaning the viral load of the mother decreases as she takes the antiretroviral drugs or the AVR. Mother-to-child transmission is also possible at the time of delivery. So, for example, during the vaginal birth, the normal spontaneous vaginal delivery, there is a possibility of transmission. Let's say, because of the amniotic fluid coming from the mother or any vaginal fluids that could penetrate into the eyes or the mouth or even to the mucous membrane of the child. Let's say also in the wound, for example, if we do a newborn care or the cord care, no? So that's actually an open wound as well. So that can be a portal of entry of the virus. And the postpartum. So mother-to-child transmission is possible when the mother breastfeed the baby. But at present time, since the AVR or antiretroviral drugs are available, so the risk is also lessened right now. So HIV is not transmitted by the insect bite. So this is actually a myth because it's not a malaria, it is not a dengue fever that can be transmitted by a vector. So insect bite is not possible. Even using the toilet seats, so if you use the toilet seats or the same toilet bowl used by an infected individual, so that is not possible. Okay, that's not transmittable. What if you perform a kissing or you kiss a person with HIV? So generally, it is not transmittable through kissing. And then sharing of cutlery or sharing of the utensils. So if you use the utensils of a person with HIV, so HIV is not transmittable. And even touching or hugging the person with HIV, so it doesn't affect you in terms of your HIV status. So basically all of these are the myths and they are not true. So what are the important variables? So the semen and seminal fluids. So if there's a presence of semen or seminal fluid, then that is a body fluid. The blood and blood products can also be contaminated. Cervical and vaginal secretions can be contaminated. Even the breast milk and amniotic fluid. So with the presence of these blood and body fluids, then the HIV can be transmitted. So what are the signs and symptoms? So we have here a mononucleosis-like symptoms. Firstly, mononucleosis is kissing disease. So we can obtain this one if we kiss someone with infectious mononucleosis. But in this case, as a sign of HIV, the mononucleosis-like symptoms can be actually present, no? So, physical symptoms are also observable, such as the extreme fatigue, headache, fever, and lymphadenopathy, or the swelling of lymph nodes. Okay, so these are the signs and symptoms. Also, the persistent diarrhea or the loose bowel movement, the sore throat, loss of appetite, or weight loss, which are also observable to the HIV or AIDS client. So, note that the symptoms generally develop 6 to 12 weeks after HIV exposure and may last a few days to weeks. For mental manifestation in the early stage, the forgetfulness and loss of concentration is present, and even loss of libido. So wala nang gana makipagtalik, apathy, and psychomotor retardation. So in terms of later stage, confusion, disorientation, seizure, loss of memory, and coma or comatose or loss of consciousness can occur later in the later stage of HIV or AIDS. So again, the acquired immunodeficiency syndrome, if the person has AIDS, that means the virus has almost destroyed his or her immune system. This makes person vulnerable to other diseases. So opportunistic infections such as tuberculosis can be present. Pneumonia, cancer, and diarrhea, are actually can invade the person with HIV or the person with AIDS. So these are the pictures of some of the opportunistic infections: tuberculosis, the fungal infection in the mouth, the swollen lymph nodes, and this one, which is what we call Kaposi's sarcoma, which is evident in the skin of an AIDS victim. So what should we do? If you think you've been exposed to HIV in the modes of transmission that we have mentioned, the BUM, the boom 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 boom, which is the blood, unprotected sexual contact, and mother to child transmission. So if you are exposed, or you think that you are exposed, then you should get tested as soon as possible. Okay, as soon as possible. So it is actually detectable. The HIV is now detectable with the use of the kit. The kit that is, for example, if the blood is withdrawn from you, or the specimen being utilized is the saliva, then that is actually possible. So you need to be tested. Actually, 15 to 30 minutes, the result is actually available. So the steps to prevent getting or transmitting HIV, we need to protect yourself and protect your partner. So by what means? The first one is letter A. So the ABC, or the prevention or preventive measures. We need to abstain. So we should not do a sexual intercourse to everyone. Of course, we need to abstain. So no sexual intercourse at all. We need to be faithful with our partners. So that is letter B. The letter C is consistent use of condom. So the condom is a type of barrier. So it is not just for the contraception, but as well as to become a barrier against HIV infection. The letter D, we should not use or do not use or share contaminated syringe, particularly to those who are using injectable drugs or those drug addicts. The letter E is we need to educate yourself. So right now you are using or you are listening to our HIV education or HIV video, and I hope that you learned something about the prevention, mode of transmission, and the difference between HIV and AIDS, as well as its signs and symptoms. During December 1, the awareness on World AIDS Day is being celebrated. So let's support the HIV and AIDS awareness, and but not spread the virus. Okay, so spread the awareness but not the virus. So thank you very much for listening. I hope that you learned something about HIV and AIDS. Bye.